Alors bonjour à tous, bienvenue.
So hello everyone and welcome to this press conference to go over the COVID-19 situation in Quebec. The Premier, Mr. Francois Legault, is together with the Minister of Health and Social Services, Ms. Danielle McCann, as well as the National Director of Public Health of Quebec, Dr. Horatio Arruda. Mr. Premier. Hello everyone. I'm going to start with the days. With the numbers, we have 97 new deaths for a total of 1,340. So, of course, my thoughts are with those deaths which unfortunately are accumulating, and I'm thinking about the families and loved ones of those people. We now have 22,616 confirmed cases, including people who have been cured, an increase for the day of 778. We have 1,460 people who are hospitalized, an increase of 49. We have 227 people in intensive care, that is an increase of 20. Right away, I would like to bring a clarification concerning the numbers that I just gave on the number of people being hospitalized and the number of people in intensive care. The numbers that I give you are higher than what they should be. So they are higher because of the fact that there are people who no longer need to be hospitalized or who no longer need to be in intensive care, but that we are keeping them at the hospital rather than sending them back to CHSLDs. That is a decision that was taken to avoid and overwhelm the work in CHSLDs, but just to tell you that it does change the data. So technically, and we'll try to do it as of next week, when we look at the number of people in a hospital care setting, there are fewer than the numbers that I'm giving you because of those people that are technically cured of COVID-19 but that have not been sent back to CHSLDs. So it inflates the numbers somewhat. And I'd like to come back to, and I've been saying it for a few days, to the fact that we really are seeing two different worlds in our world. On the one hand, we have the situation in the residences for the elderly, which is difficult. And on the other hand, we have the rest of society, which is doing relatively well, which is stable. I just want to tell you, it is not a situation that is unique to Quebec. A lot of places in the world, and if you read a little bit on it, you'll see a lot of places in the world, there is a great percentage of deaths that come or that took place in the residences for the elderly. Some examples, this is the case in Spain, in Italy, in France, in Ireland, in Belgium, in Portugal, in the United States, in Singapore, in Scotland, in Australia. It does not in the least excuse the situation in which we find ourselves with the CHSLD situation, but it's just to tell you that I think that it is everywhere in the world that we realized and that we were unprepared, not just in Quebec, but everywhere in the world, that when this virus comes into a residence where there are elderly people, it's a little bit like setting fire to dry hay. Everything goes up in flames very quickly, or at least a good part of the people in CHSLDs get infected, and it becomes easily out of control. It's not much of a consolation, but it's just to say that this is not something that is unique to Quebec. And personally, I'll speak for Quebec, I am learning quite the lesson from this. You know that we were already working on houses for the elderly. I asked the people who are on that file to accelerate it. So in the next few months, you will see, I want us to correct this situation. None of us in Quebec are proud of this, and it has been going on for too long. So of course we want to pay the people better, and we also want to have more staff in these new elderly homes, but it's not enough to talk of staff. We have to have more space to avoid for a fire to get lit, a little bit like a barn full of hay. There has to absolutely be more space to be able to separate people, more space to be able for the staff as well. That was already the concept that we had in homes for the elderly, but I've asked the president of the Treasury Board to really accelerate things so that we are able to put all the staff that is necessary, but also to, as quickly as possible, have places where we could avoid experiencing what we are experiencing now in Quebec and everywhere else. I'd like to get back to that fire that we had to put out in the short term, because that is what our priority is, even though in parallel we're also working on measures to change things in the midterm. It remains that in the short term we have a problem with lack of staff in our CHSLDs, and I want to tell you, when we started answering the people who had filled out Je contribue, we required two things: that they be qualified and that they accept coming working full-time to avoid having too many people coming in and out in CHSLDs. We are reviewing the list, and today I want to ask people who have not registered on Je contribue to register to come and help us out in CHSLDs, the public ones. It's important. Even if you don't have qualifications, if you are available full-time, while I'm asking you, because we need you to come and care for our most vulnerable. And I just want to say, of course, this is not going to be volunteer work that we'll be asking you to do. All the people, even the people who are not qualified, are going to be making the wages that we give, which is the lowest in CHSLDs for what we call service help. So I asked for the amount, including the premiums, and that gives an amount of $21.28 an hour, $777 per week, $3,368 per month. So we are ready to offer those wages to any person who wants to come work full-time, even if it's a person who is not qualified in health. So who is ready to come and give a hand. We need you. So I'd like to come back to our two worlds here. It remains that if we put aside CHSLDs, the situation is under control. That is what the scientists are telling us. The situation is under control, which does not mean that we shouldn't be prudent, but it does mean that we'll be reopening society gradually. We said it. We are going to present you with a plan next week. So it's not next week that things are going to start opening. We are going to be presenting a week next week for the reopening of schools, the reopening of businesses. It's important, however, that the measures that we've been talking about for a long time, that they remain. That means always staying 2 meters away, 6 feet away from other people. And in the cases where it's not possible, yes, we will be strongly recommending the use of masks. So when you are unable, whether it be in public transportation or at your place of work, when you're unable to always stay 2 meters away from other people, yes, we will be suggesting quite strongly to wear a mask. And just to tell you and come back to it, I know that there are still people who are worried. We'll be doing that gradually, and we'll be testing as we go along as well to make sure that the fire doesn't start up again, so that we be able to remain in control. However, what I want to tell you is that there will always be a risk. But if people stayed at home for months yet to come, there would also be risks of problems associated to mental health. So I know that, me first, for weeks I've been trying to put in everyone's minds that we have to stay home. And we succeeded. Well, and I thank you. I'm really proud to see how Quebecers have respected the guidelines. But now we have to, deprogram ourselves, me first, but you also, to be able to change that mindset again and that approach again and our attitude. So life is going to be different. We're going to be staying 2 meters away from other people for months to come. But we do need for Quebec to be born again. We need for life, normal life, to start again. We need our friends. We need to slowly and prudently to start again with life in society. It's true that it won't be the same life as before. We'll be different. We're not going to be quite the same as we used to be. But I think that we'll have grown from this collective hardship. And I think that it's important more than ever to remain united. And yes, there's a lot of work that we still need to get done with the residences for our elderly. It's not time to get discouraged, however. It is time to stand up, work at fixing this problem, and at the same time, slowly and gradually start taking up our normal lives again, finding hope, finding pride. And I am convinced that we are capable as Quebecers to get through this and to gradually get back to a society that remains unified and proud. Thank you, everyone. English.
Good afternoon. We have now two different situations in Quebec. We have our national emergency in the senior residences, where we continue to do everything we can to bring in more staff. And we have the rest of Quebec, where the contagion rate seems to be under control. As I've said yesterday, we won't reopen next week, but we'll announce the timeline so everyone can prepare themselves. Everybody will have to follow the public health instructions. We'll need to continue to keep our distances. Wearing a mask in public will also be recommended when you cannot stay at least 2 meters of other people. I know we're going to a tough situation right now, but we must prepare ourselves for the coming weeks and months. We are winning the battle against the first wave of contagion, but the war against the virus is only beginning. We must continue our efforts. We'll get through this together. Thank you all.
Merci, Monsieur le Premier ministre.
Thank you, Mr. Premier. We will now start with the question period. Hello, Mr. Legault. It's very interesting what you're saying on the fact that we have to deprogram ourselves. You are conscious, of course, that for 6 weeks you've been coming at 1 p.m. every day to say, it's dangerous, be careful. And now, how are we going to convince people that it's still dangerous, but there really is no other way? Well, that's what it is. It's a big challenge. And to a certain extent, it's almost like we're a victim of our success, together. People listened, and they listened well, and I'm proud of that. I'm proud to see that Quebecers, we remember the report that showed that in the 60 states and provinces, it was in Quebec that people were the most, that they confined themselves the most, that they accepted changing their habits. And now we have to ask to change their habits again and to have a certain opening to deconfining ourselves, but gradually, and that is what is important to say. And that is where we can control the risk You know, when we start going out gradually again, we'll be able to keep the situation under control, make sure that it doesn't overflow into our hospitals, but we cannot wait for a vaccine. The specialists agree with that. It's going to take 6, 12, 18, 24 months before we get a vaccine. So if everybody remains inside for that entire time, some people are going to have mental health problems. So we won't have fixed anything. But I quite understand that it is a challenge that we have ahead of us to reprogram our way of thinking. Mr. Arruda, could you tell us where we're at with the immunity of people who have had it? I know that you touched upon it yesterday. We know that they are immunized, but we don't know for how long. What do we know about this? What does the research say? Well, they continue doing it, but we don't necessarily have the answers that we'd like to have. And I would like to say, you know, that to go with the deprogramming that the Premier is talking about, you remember I've been telling you since the beginning, and I already knew that one day we'd be saying we're going to have to come back. And it's true, and it's going to be true according to the knowledge that we have. And that plan to reopen things, there are conditions, and the Premier is well aware of it. If we open things and we see that we are starting things over again, well, we'll have to slow the pace or even take a step back. But it's true that we can no longer tolerate that. And the pediatrics are agreeing with that. There are problems, you know, with addictions, family violence. There's other problems. And what we know, as we did recently, we probably have a certain level of immunity. So people who had it this season, if there is something in the fall, if they get ill in the fall, they're not going to have as ill as the people who are entirely virgin as far as the virus is concerned. But is that going to last a year, 2 years, or not at all? After that, in 2022, I think that we don't have enough information for that. But we'll see it, particularly with the countries that will have a second wave, because we're not going to, you know, go check people who have had it just in case, you know. The Prime Minister of Canada talked about it. You probably heard that it might be wishable to bring back the management of CHSLDs under the Canadian Act. Oh, I saw you raise your eyes to the sky. Under the Canadian Health Act. What do you answer to that? Well, listen, we remember that when the health system was set up, the federal government funded 50% of it. So it was 50% from the federal government, 50% the provinces. Today, the federal finances only 23% of the health networks of the different provinces. So if I have a request to make of Mr. Trudeau is that he gets back to 50% and will take care of managing the network. But I believe that if the federal government could do something, it would be to bring back the health transfers to the original level. Right now, it is reported, Ms. McCann, that there are doctors who go in CHSLDs and who are recalled to hospitals. That is what happened in the CHSLDs that the Premier said that, a fire was lit in the hay. Is there not a risk? Well, I think that what is important is that the protection material be worn correctly. We know that doctors have very good knowledge in the use of protective material. So that is the first thing. Of course, it also depends, and I will ask Dr. Arruda to add something on that, because it depends on where the doctor worked and in what department they worked at the hospital. There might be additional measures to be taken, but basically the material has to be worn correctly. And, the basic guidelines that when you leave a hot zone, there are measures to be taken. So for the transition, I will give the mic to Dr. Arruda. Yes, it's evaluated on a case-by-case depending on the clientele. As soon as a doctor may have symptoms, of course, we don't want them to work, but you're going to say that there are people who are asymptomatic, and that's true. But in the context of care, I would say that people are going to wear they're going to really follow the precautionary measures and be careful about how they wear their material. It's perhaps easier in certain contexts than others. But I think that there's also community circulation that we have to think of. So it doesn't mean, there will be risk even for doctors who did not go to CHSLDs. They could just catch it in their other community activities. And that is why it's so important. Once again, whether for doctors or all healthcare workers and the population at large, it's important that the deconfinement be done progressively, but also it doesn't mean that the day that we deconfine that everybody ends up having, dinners at home with their grandparents and a nice beef. We all feel like having that, but we're not there yet after that intense phase that we just went through. So I invite everybody to keep a dosage. We are going to reopen in certain sectors and people who are not at risk, but we're not going to mix everything together because otherwise it's going to bring a wind of freedom. And it's going to be difficult for those who will still have to remain a little bit more inside, but we're going to have to do it that way. Now, if I could continue on the same theme, along the same line, and the question is for Mr. Legault and Dr. Arruda. You now insist on the need to have collective immunity to justify the deconfinement that is gradual. Now, there is that recommendation for the wearing of the mask and distancing in order to limit the spread. But if people who are less vulnerable, if they are to catch the virus, why should they wear a mask at school, for example? Well, we know that right off the bat, if you wear things, but people are not going to wear it perfectly, that means that there will be contamination. But we don't want it to circulate too quickly because we don't want a situation for the region of Montreal where there's more transmission, for example, that the Montreal hospitals have a hard time taking care of the patients. Of course, the difficulty that we have is we can't predict who are the people in good health who may get ill. The chances are a lot lower than people who are elderly or have chronic problems, but we're going with risk management. And I want to say, yes, we want people to get immunity because that will help us decrease the transmission, but there's also a question of the perverse effects of confinement that we have to try to prevent. Mental health, people who usually have access to food services and children who had meals in schools that were served and no longer have them right now. So there's also that has to be taken care of and taken into consideration. So it's like a mix of, yes, we want people to get immunity, particularly those people who don't have risk factors and who will not be creating a pool for others later. But there's also bringing back a balance between confinement and all the other health problems that can come. And pediatrics shows us that, there's a certain clientele of vulnerable children, for example. Now, in 2006, in the plan to fight the pandemic of influenza, the Ministry of Health mentioned that health establishments had to have lists of people that could be called as reinforcement to replace the thousands of workers that might be absent in the case of a pandemic. To your knowledge, is that something that was done? And also, Je contribue, is that not an example or another example of a failure of centralization? Well, listen, I think that first we had a shortage of staff in the health network. I said we had before the pandemic, Of course, now with the absentees, it's been accentuated. As far as the Je contribue website is concerned, as the Premier was saying, at the beginning, we were looking for people with expertise in health and social services. But now, of course, what we're saying is that we're going to go through the whole thing again. And the call of the Premier today, I think that, and I hope, that it will draw a lot more people. And now, of course, we could have, once again, I hope, thousands of people to come and help us. So I think that Je contribue is taking a different angle at this moment because the situation has changed. At the beginning, we needed expertise in health and social services, and now we need hands to really take care of the elderly. So Je Contribue has a very important function. Yes, there is a big problem in CHSLDs, and we recognize it. But it has to be understood that the mobilization plans exist. They already existed in the frame of the Act on Public Health and the pandemics. But in the teams of Health Public to do inquiries in Montreal, for example, whereas there are fewer than 100, right now we're 800 people. In the teams of public health of the Montérégie and elsewhere, we are mobilizing resources, and we are remobilizing even more for the phase of the measurement of our interventions. And in the healthcare system, we didn't have an issue, but there would have been. We succeeded in protecting our healthcare system in a balanced way. But at some point, it does become, we can't invent individuals, we can't clone them, but we do have mobilizations, and we have team backups to allow people, since it's lasting for a long time, to not get ill and to be able to take one day off per week or a half day off per week, and in that half day, you're still working, but at least you're at home. So there's that kind of element that is, yes, it was using the mobilization plans as such. Hello. I'm wondering about the curves that we use to try to see the state of the situation in Quebec. When we're talking about the number of hospitalization, we realize that it's still on the increase, sometimes bigger than others. But yet, according to what we're saying, we would have reached the plateau, the first wave of the epidemic. We might even have passed it. How is it then that we still can see that increase in the number of hospitalization cases and even the cases that are reported? Well, when I explain what I said earlier on, we have identified the people who are hospitalized in intensive care. And they shouldn't be there, but we chose to keep them at hospitals. We didn't want to send them back to CHSLD, so that inflates the numbers. If we take that into account, not only is there stabilization, but there's a lowering. But we will get back to you with numbers that will come and confirm that next week. And if you allow me, Mr. Premier, there were the cases. We probably had the peak, and it's contaminated by the story of CHSLDs, because if you look at the community in CHSLDs, the peak was reached in the Montreal region around the 4th of April. However, it's 15 days later that the hospitalizations appear, and the deaths are even a little bit later than that, because that's how long it takes. And now what's happening, and that is also what happened, is that at the very beginning, there were even people who were in intensive care who, in a usual context, wouldn't have been in intensive care. We had cases at the beginning where, if we compare ourselves to other countries, they wouldn't have been to intensive care, but we had room, so we placed them there. And then there's also elderly people who arrived from CHSLDs who were either in intensive care or in the hospital, and who, for reasons where, there's forest fires in certain CHSLDs, we said rather than send them back where there's already a lack of staff, we'll just keep them at the hospital. So those people are probably going to be going to transition environments where there's going to be care that is adapted to their needs, which is not ICU, and that has artificially inflated the numbers as far as the number of hospitalized people. So we will be correcting that. We will go through all the numbers again, and we'll have more specific numbers for you. So we really do believe that that is what the phenomenon is, and that is why there is a sort of plateau, but we're probably already on our way downward. Do you have any indications, because you were talking about how heavy the burden of confinement is for Quebecers, that it could have an impact on mental health, on the treatment of children, violence against women? Do you have any indications at public health of that heaviness, the cases of violence against women, the cases of children that don't have the services that they need? Do you feel that in what you have as information? Well, it's not necessarily just public health. I can tell you that we've been making surveys, and we can see the mental state of people, the signs of depression. There are surveys being done through different mechanisms, either with our communications at home, but others. And we can see that there are indications. It would seem that there was a decrease of declarations to the DPG, and that's another phenomenon, because to declare, you have to be able to see. And if everybody is confined, well, you can't. So we have certain indications that, and also certain elements, calls to 811. And clinicians as well, either from the psychological domain or others, are giving us that kind of information. And at any rate, it is known in the literature that, isolating the most vulnerable who don't have a family support is a very important person, and so is locking everybody up. And the plan, we have a few steps to go through to give more answers in the mental health aspect. We want to increase the possibilities of response, that people be able to have follow-ups over the phone as well, of course, or in person when required. In mental health, we're really going to increase our offer of services in the short term. And if you allow me, Ms. Martin, who takes care of mental health, is also seeing to have a plan to support the families who have lost loved ones, because there are people who are mourning in a context that are very different than the usual context, and we probably have to, in my opinion, have approaches with those families. Yeah, we'll be giving you more information, because it will be a special program for families going through mourning, because, of course, the situation is extraordinary right now for those families.
Monsieur le Premier ministre, Madame McCann, Monsieur Arruda. Monsieur le Premier ministre, compte tenu de ce qui s'est passé.
Mr. Premier, taking into account what happened in the CHSLDs, we're thinking, for example, of what happened in Heron, the private CHSLDs and other establishments as well, taking into account what Mr. Trudeau said this lunch concerning CHSLDs. Are you thinking of nationalizing CHSLDs? That is to say that from now on, the state is going to take care of everything, to make sure that we have a minimum of standards. I'm not excluding that. I do think that, in fact, in CHSLDs, we have fragile people who need care. In Quebec, care is a public system. So should we have all CHSLDs as public entities? I'm not excluding it. We're going to have a look at the situation quite well over the next few weeks, but we can't exclude it, no. Are you asking there to be evaluations that will be done in that sense? Do you have any idea of the way that it could be done, how much it would cost, for example? Are there steps that are being taken? Yes, we are also looking at when contracts come to an end, because there are private CHSLDs under agreement that have specific contracts, and there's a lot of contracts that are going to come to an end soon. So there would be an opportunity of transferring those CHSLDs to the public sector relatively easily. So we are looking at that, and we are putting numbers on it. Mr. Premier, the Quebec Federation of Municipalities called out to you directly, saying that it is up to the, many small businesses in villages and entire villages whose survival depends on reopening, grocery stores. And they say that those, they don't need a loan. They need direct help to be able to get through the future, $5,000, $10,000, $15,000. Would it be possible to have that kind of a program for this, the small companies? We're not excluding it. There are already some programs that exist, either managed by municipalities or directly at Investissement Québec or the Ministry of the Economy. And I also think that what is important is to reopen them quickly, the small businesses. So we are working hard on that. But yes, we're looking at getting help, and I'm very conscious of the fact that small businesses are really having a hard time, and they need financial help. And you have regularly alluded to the new policy for local purchasing in terms of buying medical equipment, food autonomy. Would there not be problems with compliance? And I mean, everything that we have, the agreements and procurement and internationally, aren't we going to go against the international agreements that we have signed? We cannot neglect, yes, the respect of international agreements. However, there is a possibility of buying a lot more local, and I think that the government and its ministries and its organizations should buy more locally than what we see right now. Also, we can't be naive. I'll talk of China, for example, where we export 4 billion, but they export 12 billion to us. It's very difficult to be able to get into certain markets, such as the Chinese market. So we can't be naive. If the market on the other side is not accessible for our companies, I don't see why we would not make sure that our markets are also not a bit more difficult for them. So there are ways of circumventing those international laws, but of course we have to produce more in Quebec with our companies and our workers in Quebec.
Bonjour. Des agences privées,
Private agencies of staff placement have been inflating their prices since the beginning. Some of them are even going foraging into the elderly homes, and they want higher levels. What measures, what concretely can you do to prevent them from doing that? Well, it doesn't make sense that some agencies are taking advantage of the situation to take a huge profit and to take advantage of the fact that we have a scarcity of staff. So I have asked Daniel, in whom I have complete trust, to quickly fix that problem. Yes, and we exclude nothing. We're looking at everything, whether it be regulations, whether it be legal. This rating is unacceptable. We will be proceeding quickly. Concerning the elderly homes, you're saying that you want to increase or accelerate that, but those homes for the elderly will not be replacing the CHSLDs that already exist in Quebec and where there are already users. So we have to be able to continue talking about this. We can see that the demand for this kind of service is going to continue increasing with the aging of population. How are you going to make sure that there's no two classes, the ones that are going to have the AAA access to the elderly homes and the ones that are going to be stuck in places that are from the last century? Yes. First, I don't like the name of CHSLD. It's very bureaucratic. I prefer homes for the elderly. It's more personal, and we want for homes for the elderly, while having more space, have fewer residents in total so that it be more similar to what we can see around a house. That's the first thing. Second thing, right now people are just too, bunched up in CHSLDs. And as we go along, and we'll go quickly, as we build homes for the elderly with more space, it will also free up spaces in the CHSLDs right now. We're going to be changing the standards and improving them, renovating them, but we do have to count a certain amount of time. But I want us to proceed very quickly in the next year or the next couple of years to be able to build as many homes for the elderly and as quickly as possible to finally offer our elderly what they merit, which is a place where they're not going to be crammed and where we're not going to be, letting up fires and dry hay, such as we've experienced with this virus, where there's room, and it's going to be done as quickly as possible. And the president of the Treasury Board is working very hard so that it be set up in the next few months and that we get to work to build these beautiful homes for the elderly that we have to have. I would also like to add that we are reorganizing all the work being done in CHSLDs. For example, having dedicated teams to one CHSLDs, and really to be organized by unit. That is fundamental for the next year, yes, but for the future, because we can talk that there can be different infections, like the flu and or gastroenteritis. So that will remain. That's a big reorganization that we're going through, of course, with the necessary staff. And we are setting up the necessary conditions to have more staff. And I would also like to add that taking into account the fact that our population is getting older, that we're going to have more needs, well, we're also going to have to give more maintenance or help at home, because people have to be able to stay at home as much as possible. We have to do everything in the plan for homes for the elderly. It's fundamental. And at the same time, we have to allow as many people as possible to be able to stay at home. So it will be very, very important. Already, as a government, we've invested a lot in our first year in power, a very high budget, and we have to continue allowing people to be able to stay at home and to have important services. We also have a lot of transition solutions, like the Hôtel Dieu. We are right now using the Hôtel Dieu, renovated, so that can also give more pleasant spaces temporarily until all the homes for the elderly be built. Children, youth, and people who are not as vulnerable will be called to deconfine themselves progressively this summer. The grandparents and great-grandparents, will they be able to hold their grandchildren in their arms? What are you asking them to do over the summer? Well, unfortunately, I do not advise people who are over 60 to hold their grandchildren in their arms for a certain amount of time left. I know it's hard. I know it's sad. We're going to be able, in the next few weeks, at the very least, to see whether they could see one another at least 2 meters away. That is something that could be considered. But holding children in their arms, especially the fact that we want to gradually reopen our schools, the greatest fear that I have in the reopening of schools is that the children will go see not their parents, but their grandparents and infect them. We have to protect the people who are 60 and 70 and over. It's very important because they are vulnerable. So there are real risks leading up to death if they catch COVID-19. So it's to protect them that we're doing it. It's not because we don't love them. If you allow me, Mr. Premier, also, it's a sacrifice that this represents because, it's natural to take our children in our arms, but what we want, as you said, is that they be able to take them in their arms as long as possible. If, looking forward to having a child and to take your grandchild in your arms leads to a death, well, that child is not going to be able to enjoy the presence of the grandparents for a long time. To your estimates, how many Quebecers could die of COVID-19 during the confinement phase, whether, starting with going back to school in the summer? Well, that's difficult to say, but for sure it's something that we're going to be monitoring. I want you to understand that the first steps that will be taken will also be taken in conditions that are not at all the same as what we are used to having. So schooling is not going to be like we used to have. It's not going to go back to school like what used to happen in January. It's going to be a model that is going to decrease the risk of exposure, we hope. As soon, of course, as we start having people circulating, there can be people who are going to catch it, people who are going to end up at the hospital. We're going to put all the conditions to be able to decrease. And I want to talk about the mask. I'm going to take this opportunity because I have to talk about it. Mr. Laforêt, did you have a question on the mask, or can I go? You'll have another bonus question if you're lucky. Listen, I just want to tell you, I told you that I would be, driveling. Masking community or, the homemade face coverings. Do not replace washing your hands, social distancing. And if you have symptoms, you stay home. You call 811. You put something to cover your face, over your face, you get evaluated, and they're going to give you a real mask. What I want to say, however, is that we understand that if in the context where we reopen, that in, transportation means that at the grocery store, in certain places where you might not be able to respect the 2 meters, so we're going to be proposing to use a mask that you can even make yourself there are different models that are going to be shown here, some with seams, some without seams. So if somebody who has symptoms or before symptoms used to cover your face, and when you get closer to the people, you are going to be wearing it and you're going to be careful because it's going to prevent your droplets from going on other people. It won't necessarily protect you, but it is a way of protecting others. So you have to put it on properly, you have to take it off properly, you have to wait to wash things, and for that there's an explanation, a pamphlet that we made in both English and French. The first part reminds you of the guidelines, the second part tells you how to make one. There will be videos, and Dr. Vadeboncoeur, whom you know, is going to have a video where he's going to explain how to put it on, how to remove it, how to use it, to wash your hands before, to put on the mask, and to not touch it, to place it well on your, nose, to not have it on your chin, to not have it just dangling down from one ear. And we're going to be following those recommendations. So the question of the mask, I hope that people will be answering. And there's all sorts of videos on the web as well to tell you how you can make your own homemade mask with a bandana. What is important is to have something of a material like, cotton, which is pretty tight, but to let air through. And people below 2 years of age, they can't wear them. People who have important pulmonary problems, they can't either because the mask decreases the oxygen that you have. And people who can't put the mask on themselves shouldn't use them as well. So something that doesn't get deformed in cotton, that is easy to wash, You could add a little bit of design with a color or whatever if you want, and then you will wear it and you'll put it on and you wash it adequately, and all of that will be explained to you, and you'll be able to have and see videos that there's all sorts of methods to do that. It's a good scarf even that you fold over your face could be very good, and other seamstresses could do it. Monsieur Legault, I don't know if you wanted to add something, or Ms. McCann on the question of masks? No, that completes? Okay, so I would propose perhaps Dr. Arruda to repeat in English what you just said about masks.
Asking about masks in the community. As we told you, mask is not replacing hand hygiene, distanciation, or if you're sick, you don't go take the bus. You call 811, you put some time over your face, and you go consult your doctor. But as we're going to be more people outside, actually, as it won't be easy to have a 2 meters distance everywhere, especially in bus or metros, or even when you go to grocery. What we will suggest you is to use a mask, which is we call a cover of the face. We have published, I would say, a 2-side pamphlet in English and in French. Dr. Vadeboncoeur is doing a video to explain to you what to do. You wash your hands, you put your mask, how to put your mask, what not to do with the mask. If you touch it, you have to wash your hands, and the way you put it in the garbage. You're going to have this information. And you will find in different videos, if you Google masks, all kinds of recipes to do it. We have chosen two. One with sewage, one without sewage. So it's easy with elastics that you can use for your hair. You can use them with I would say, a piece of cotton. It's nice to be at 2 sides pieces, something that you can have some hair in between. It's easy to do. You put it in your face and you use it. But don't forget, I'm going to be a crazy guy, always repeating the same thing. Wash your hands, keep your distance. But if you cannot wear that kind of mask, that would be okay for you.
Thank you very much. So now for a question, we'll start today with Ketsani, CBC News.
After this colorful presentation, good afternoon. Premier Legault, the crisis in the CHSLDs was hard enough for you to watch that you say, okay, I'm thinking about taking over all CHSLDs, even the private ones. You're at that stage?
I think I don't exclude that. So I'm looking at this scenario to bring back all CHSLD in the public sector. Reason for that is there's a part of the services that is about healthcare. We're proud to have in Quebec a strong public healthcare sector. Everybody, rich or poor, they have access to those services. And that's why we're looking, because I want to make sure that in the future we'll have nice places with a lot more space. We'll call them Maisons des Aînés. We'll have a lot more nurses and workers. And I want to make sure that the quality of service is what is the best. I think that our elderly, we owe that to them.
Question?
Second question is regarding what you said about keeping patients that should be returned to CHSLDs. We're keeping them in hospitals. Don't you think you're just basically putting the source of the fire somewhere else, and they are dangerous to this?
No, we were expecting up to 7,000 people in our hospitals having the COVID-19. We're only at 1,400 at this time, and honestly, in the 1,400, we have many of them that are ready to go back to CHSLD, but because of the situation in CHSLD that is tough, and because we have so few number of people in our hospitals, I think for now, short term, it's better to keep some of them in the hospitals.
The situation under control.
Yeah, and it's under control.
Okay.
Sorry, the next question has been sent by Philote Montreal Gazette. It's a question for Mr. Legault and Mr. Arruda. For some Quebecers, your message Thursday about mass immunization is hard to understand. After telling Quebecers to stay home, now the message is it will be okay for the virus to spread even among children. What more can you say to ease the fears of many people?
Okay. I think that reason why, since 6 weeks, I'm asking people to mainly stay at home is because the evolution was too fast of the number of cases, the number of deaths, and we needed for a certain period of time to slow the spread of the virus. But we know very well that we won't have a vaccine until a year or two, most probably. So we cannot ask people to stay inside for a year or two. But what we have to do is to gradually, and that's the important word, gradually let people going out, let children going out, let the people that are not at risk, which means under 60 years old, because still in all the deaths we have in Quebec, 97% are people of 60 years old or more. So what we are doing is to gradually reopening life, reopening companies, reopening schools, and we'll test every week to see if we're not going too fast. But you'll see in the plan that will be tabled next week that it'll be done gradually. We're not talking about opening next week. We're talking about a plan to reopen over many weeks.
Thank you. Phil's second question is for Minister McCann. Many families are concerned about their parents and grandparents living in residences. We have asked the ministry for a breakdown of death in specific residences. Your officials say they do not have this information, which seems quite basic. Can you fix this problem so that the government is more transparent?
Yes, we do have it, and public health has the information too, so we can provide that information by residents, certainly.
Thank you. The next question is from Raquel Fletcher, Global News, for Mr. Legault. You really scared people into staying home. Quebecers have respected the order to stay home better than all other Canadians. How do you get people to go back to school and work now?
Okay, I'll try to re-explain what I said, maybe with my figures. 6 weeks ago, the virus was spreading very fast, at least 2 for 1. So it means 1 people infecting 2, then 4, then 8, then 16, then 32. So what we wanted is to stop that, to stop this too fast increase. But it doesn't mean we have to stop completely everything, because there's no vaccine. So what we want is to have more people that are immunized. So it means that if, for example, we have 50% of the population that are immunized, supposing that the factor is 2, means that then we would have 1 people infecting 1 people, infecting another 1 people. So then the situation is under control. But it doesn't mean that we stop everything. We just have to slow the spread, slow the increase that was too fast.
If I may add.
Yep.
Yeah.
From
Please.
a health care perspective, that people over 60, as you mentioned, Mr. Prime Minister, and also people with chronic disease of all ages should be extra careful and follow the guidelines that we've given from the beginning.
Thank you. And now the second question. Stores are using very different safety protocols in the name of protecting clients and staff. Are stores allowed to ban healthcare workers to protect other clients and staff? What can be done to make it clear to merchants what can and cannot do?
Well, it's a question of judgment. We want that everybody in stores respect the 2 meters between people. So sometimes you have to close the door in order to maintain this 2 meters, but it's a question of judgment. Sometimes you can, it depends on the size of the store, but the key is really make sure that employees and customers, that they always keep 2 meters between them.
Dr.
And may add also that all kinds of enterprises or workplace will have specific information about what they can do. Experiences from one good place, best practice can be shared with others. So, and if there is no compliance to that issue, SNEST inspectors could stop or close something. So I think we're going to help the industry. We're going to help those places to know what to do. And there's going to be sharing of good experiences. And if there is some issues, we will have the power of the SNEST to do inspections and make sure that people respect those recommendations.
Thank you. And now 2 last questions for CTV News. CTV Montreal has spoken with a healthcare worker who has recovered from COVID-19, but it has taken more than a week for him to get an appointment for a test to prove he is COVID-free. In the meantime, he can't work. Should healthcare workers be given priority for testing?
Absolutely. Healthcare workers, but also people who are in hospitals and in the CHSLD. I find it's very long, a week. So maybe I'll look into that a little bit more, Dr. Arruda.
Yes, I think it's not acceptable in the case. We get the capacity, and I don't want to comment on the specific story, what was exactly what happened, but they must have the results as soon as possible.
Thank you. And as a very last question, the CIUS Centre-Sud is not allowing caregivers into its CHSLDs. How can this be allowed when there are staff shortage and when the government announced earlier this month that caregivers will be allowed?
Well, it's a case by case or situation by situation, but the general message is that care workers can be allowed to come in and help. And it's a case by case because every organization has to see the implications. But we discussed this with Dr. Arruda and Mr. Legault this morning, and we have to be souple, more open for the proches aidants to come in. So we'll discuss this again with the people responsible of the organizations. And I understand that in Montreal, because the Montreal and Greater Montreal is living a different situation than elsewhere in the province. There are issues, so we'll make a point to really talk with the Director Generals again and really stress that they have to open up a little bit more to the proches aidants. I think.
Minister, I just want to tell you that by 11:30, as we met with the PDGs, we tell them. So as the decision that we've taken this morning is already a share. We go into action after you decided it.
So thank you all. Merci à tous. C'est ce qui complète pour ce point.
Thank you very much. This puts an end to the press conference. We wish all a good weekend and see you Monday.